Good morning, everyone. My name is Stephanie Brown. I'm going to be running the Health Science and Nursing Program orientation. If y'all can hear me, just give me a quick little thumbs up so I can see if we are a go. Gotcha. Good, good. So we'll get started today with the orientation for our area. This orientation, you should be here for Health Science and Nursing prep programs. If you want to be an RN, an LPN, PTA, Rad Tech, medical assisting. If you're in the patient care technician program, certified nursing assistant, or in the EMT program. If you are any of those people, you are in the right place. If you're not, you probably need to bounce back to the main orientation and get the correct link. So we'll go ahead and get started. Again, my name is Stephanie Brown. I am the Dean of Healthcare Preparation and Workforce. I have been with the college about 10 years now, bounced around. I've taught medical terminology, health careers. I've been program coordinator over a few programs, and I also taught biology as well. So some of you might see my name on a biology class coming up in the spring. And I also teach Bio 126, which is career options for the health professions, but we'll talk about that in a second. We have a lot to cover today, and it's going to feel like I'm talking a lot, but I promise you, this is going to be very useful information for you. And if you miss something that I say, I'm going to post this into your orientation, into your D2L course, so you'll have access to it. But hang on 1 minute, let me open up the chat so I can monitor that while we're talking. Yes, you can access this at a later time. So just make sure you keep up with all of your emails and things, and you'll see how you can access this. All right, so to start off, we will talk about some of the websites and systems that we have available and how you can get the information that you need to get. So first of all, if you want to locate any information, the general website, our octech.edu site, will give you program information, but also tell you how to reach your program coordinators. It'll go over the admissions process, and it'll give you access to the college catalog. If you can't hear anything, you might want to check your volume. Can everybody else hear me? Thumbs up? Yep, good, okay. So you might want to check your volume if you can't hear anything. Make sure your audio is turned on your system if you're listening on a phone or a laptop. So that's general information. And if you go to our website and you click on academics, and then under that you'll see nursing and health science, all of our programs are listed here. You can see that's your associate degree nursing, that's your RN. If you're already an RN, an LPN, and you're coming back to get your RN, that's that program there, LPN to ADN. PTA is there, Rad Tech, patient care technician. All of that information is listed on our website. Now, Connect Self-Service, you might have gotten an introduction to that in the first orientation. That's where you go to find like your business related information, like who your advisor is. When final grades post, you can get those from there, planning courses, registration, all of that is in Connect Self-Service. So you'll need to set up an account for Connect and for D2L, which is Desire to Learn. So I'm sure they probably gave you access to all this information in the first orientation. In Connect, this is what it would look like. You'd have your student finance. That's where you can pay your bill, your tax documents, you can print them off from here. Student planning is where you would register, grades, all of that is in Connect Self-Service. So all of these things you can do there. Now, D2L is the academic side. That's where you would go and access your classes, submit your assignments, view your course calendar, you can keep up with your grades as the semester goes on. Your school email is there, any campus announcements. And for our purposes, for the healthcare prep side, you all have a unique web course that's in D2L. It's called the Virtual Student Center. You probably might have seen it already, but we'll go through it a little bit today. Now, your class calendar for each one of your classes, you'll find that in D2L. That's how you can organize all of your assignments, quizzes, exams. But the college calendar is found on our website. That's on www.octech.edu. And that's where you can find if the campus is going to be closed, if we have holidays, when bills are due, when registration starts, all of that will be located there. Now, Virtual Student Center in D2L, it is a course. Again, it is unique to our program, so not all students have this. We have some program-specific announcements and calendar info there. You can find class information to help you plan each one of your semesters, program information, who your advisor is. All of that you can find in that Virtual Student Center. Now, you can click around in there. You won't break anything, so just go in and become familiar with all of that information. I'll show you a couple of things. First, when you first log in, if you need help finding your advisor, you would click right there. Some student tutorials, or there's a link here if you need to know how to register, how to access your grades, anything, you can click on that and it'll take you to some YouTube clips that'll show you everything you need to know. If you want to join your program of interest group, you would just click here. So say for instance, if you're interested in PTA, physical therapist assistant, you can join the PTA group and it'll change the look of that class for you. So yeah, let's see. When you click on the content, that's where all of the meat of the course is actually at. So it would give you a place to start, some curriculum information. There's an advising module, registration, and then it goes into the different programs. Now, say if you were to click on that health science programs at OC Tech, all of the health science programs would show up, and then you can click on your program. So like, let's see, pretend we click on radiologic technology. This would show up. It gives you when the program starts, how long the program is, all the general classes that you need, and the program coordinator, just in case you need to contact them with any questions. If you were to scroll down, you can see some useful links there. Let's see. These two checklists down at the bottom, those are actually in D2L, and they'll help you plan your classes. Like if you looked at the Rad Tech classes pre-acceptance, you can go through and look at all the classes you need for that program. What's really cool is you can see how many application points you'll get by letter grade. So if you took English 101 and you got an A, that would be 5 points on your application when you went to apply to that program, okay? So all of the programs have this. This is just, I'm just using Rad Tech as an example. The application checklist is there when you get to that point of getting ready to apply to the program. All that's listed there. Now, the programs, we have quite a few. Let's just go through all the programs. Our certificate programs, we have patient care technician. That includes CNA, phlebotomy, ECG and dialysis technician, certified nursing assistant, and EMT. And PCT is a 3-semester program. All of these different disciplines are in there. Most of your general education courses can be used for other degree programs. So if you're a PCT student and you are taking these classes, you need to really be thinking about the future as well, because we can knock out other classes for, say, a RN program, or if you want to be a PN, we can do that as well. EMT is a 2-semester program, leads to the EMT basic certification. So that's an option for you as well. Students in these classes will receive more detailed information during the first week of classes. If you have any questions, you can contact your specific program coordinators. CNA, that program coordinator is Dallas Collins, and that's her email, collinsd@octech.edu. PCT and EMT, I'm the program coordinator for that, and my email is there, gadsonsc@octech.edu. So if you want to jot that down really quick or take a screenshot, if you're in any of those classes, if you have any questions, that's how you can contact us. Okay. If you miss the information on the checklist, that's located in D2L in the Virtual Student Center. Okay, just click in there and then go to the content and you'll find all the links there. A couple of seconds, I see some people writing. Okay. Now, your prep programs, the bulk of you are probably in prep programs. These programs will help you get ready to apply to the rad tech, PTA, medical assisting, practical nursing, registered nursing programs. And you're basically working on all of your general education classes. And you'll see that term a lot, general education. It simply means these are classes that can go for all curricula. So like if you were to transfer to a four-year school, some of these classes would transfer, okay? So that's math, English, biology, psychology, humanities. Humanities is like history, philosophy, art appreciation, music appreciation. Those are humanities. Allied health science classes like medical terminology or health careers, public speaking, foreign languages, all of those are considered general education classes. And there are two options, careers and university transfer. Careers are more for students that don't see themselves going beyond graduation here at OC Tech. So the students that don't really see themselves getting a bachelor's, they're just focused on our programs. University transfer is for those students that see themselves taking it to the next level after they finish. I always encourage students to start thinking about the next level, even if you think this might be it for you. You never know once you get into the work field and you start becoming exposed to different careers, that bachelor's or that master's or that doctorate might actually be in sight for you. So just keep those kind of things in mind, because we can knock out a lot of classes before you even start your program. On our website, academics, nursing and health science, and then if you click on the preparatory link, you'll get some useful information about the prep programs. The bulk of your information is going to come from that virtual student center. So just link back to that. Now, once you start knocking out some of these gen ed courses, that's when you can start getting ready to apply to these programs, associate degree nursing, radiologic technology, medical assisting, PTA, and practical nursing. So those are all of the programs that you have to go through a separate application process to get into, okay? So at this point, we're in the preparatory phase. Now, we have another program, it's called MUSC Transfer. We might have a few of you all in this group as well. The Medical University of South Carolina has an online Bachelor of Health Science, Bachelor of Science in Healthcare Studies program. And we have a layout for an associate degree that leads to that bachelor's. So it's a transfer option there. You would finish your associates here, your bachelor's at MUSC, and then you can either go to grad school or go and work with that bachelor's. And these are some of the areas that you could work: dental medicine, graduate studies, that would be like more biomedical stuff, like if you wanted to become a researcher, nursing, health professions, that's where you have all of your therapists, your occupational therapists, physical therapists, speech pathologists, cardiovascular perfusion, health administration. There are a lot of programs encompassed in that health professions group. Medicine, that's your MDs, and then the College of Pharmacy. So keep in mind, even if you're not in MUSC transfer right now, if any of these areas sparked your interest, we can get you there after you finish with us. Like you can come back to us, work on your prereqs, and we'll get you there. Now, let's talk about some coursework. This is the point in the presentation when I feel like I'm just talking, but I promise it's all going to come together. So your coursework for your gen ed classes. You'll notice our programs listed up here at the top, and all of the gen ed classes for each one. What you'll notice on here is that there's some redundancy. So like, let's see, the ADN program, which is your RN program, needs Bio 210, 211, 225. PN needs 210, 211. Rad Tech 210, 211. PTA 210, 211. All of them need English 101, except when we get over into the certificates and the diploma areas. But these are still English, whatever the English is, or higher. So like if you took English 101, it would count for medical assisting. It would count for PCT. It would count for all these things. So keep this in mind when you get into the exploration side of your journey here at OC Tech. You might come in thinking ADN is what I want to do. But if you change your mind, your classes will still count for other programs. Okay, so it's not like you're losing time. They all sort of lay out together. Okay, so just keep that in mind. Also think about transferable classes that you can transfer to a four-year institution. I teach a class, Bio 126, which is career options for the health professions. We go through all careers. We go through all different types of topics like public health and social determinants of health, health equity, research. We go through a lot of different topics in that class. Your allied health science courses, we have intro to health careers, medical vocabulary, therapeutics for healthcare, that AHS 140, that teaches you the math that you'll need to learn in the programs. And then we have nutrition, which is required for your ADN program, So all of those are options of classes that you can add to these classes. So when you, this is especially important for our life scholarship students that have to have those full-time hours. When you get past this, start thinking about transferable classes or classes that are going to improve your preparation for starting the programs, okay? Your certificate program options, CNA, phlebotomy, EKG, EMT, all of these lead to jobs when all of these classes are finished. I can tell you these first three, CNA, phlebotomy, and ECG, all of these can be completed in only one semester. Okay, so keep that in mind. EMT is a 2-semester program. So if you were to start in the summer, you would be finished in December. So keep that in mind. These are jobs at the end of these classes. Prep students, you can take these classes inside your program. You don't even have to change your program. So it might be a semester where you're taking Bio 210. You might say, you know, I want to get my CNA license at the same time. You can take Bio 210 and AHS 163 and AHS 106. And at the end of that semester, you'll have an A in Bio 210 and you'll have a CNA certification. So keep that in mind. These are the college catalog cutouts for CNA, for PCT and EMT. All of these are available on our website if you want to go in and read in detail. Our advanced degrees. So we talked about what you might want to be after you finish here at OC Tech. If you ever saw yourself becoming a medical doctor, or if you want to be a physician assistant, we have classes here that you can take that will help you get to that point, okay? So if you finish most of your prerequisites and you want to get to this level, this physician assistant level, this is just one that I'm picking, we can add in Psych 203, Math 120, that's statistics, medical terminology. We can add that in to get you to that point. And it's cheaper to do it with us than it would be at a 4-year school. So just keep that in mind. Course offerings, we have several different types of classes being offered right now. Online classes, those are section 40 classes. Those classes are completely virtual. You won't see any schedule associated with a true online class. Your traditional face-to-face class that has a scheduled meeting time, it has a location associated with it, building number, a building letter, and a number. Your hybrid classes, those are the classes that you might see, like say for instance, a Bio 117.05H. That means that part of the class is online, part of the class is face-to-face. Usually the lectures are online and the labs are face-to-face, okay? Your synchronous classes, those are online classes that meet at a set time. So you might see, say, AHS 104, section 01HS. That means it's hybrid and it's synchronous. You'll see a scheduled time. You have to be online at that set time, okay? Let's see, we have day classes, we have night classes, we have mini-term classes or late start classes. We have a lot of options for you. So just the biggest thing is pay attention to your schedule. Look at the schedule, the letters at the end of your section, and what you see listed for the meeting times. If it says virtual, that means it's online. If there's a set time and it says virtual, online at a certain point. If you see a set time and a building number, that means you gotta be on campus at a certain time. It's a lot, but it will all be spelled out in your schedule for you. Now, updates for spring 2021. All of our classes will begin virtually the week of January the 11th. So on Monday, all of our classes are meeting online, okay? Beginning Monday. So if you have a Monday, Wednesday class that's supposed to meet on campus, you're going to meet online on Monday and Wednesday during that time. If you have a Tuesday, Thursday class that's supposed to meet on campus, you're meeting on Tuesday morning at that set time, but online. The biggest thing that you need to take from this slide is that you need to check D2L for all announcements and all of your class information. Be a little patient with us because we're still getting things uploaded. So you might have classes that are empty right now, but we are getting everything uploaded as soon as we can. All of your classes, everything is online and virtual for next week up until January the 25th. That does include labs as well. So you are not coming on campus next week, right? Let's see. Did I miss anything? Virtual, January the 11th start. Face-to-face components will start January the 25th. Now, I will say, as we approach January the 25th, pay attention to your announcements, because if we have to extend that, it will come out on D2L, it will be on our main webpage, and you should get an email or a text message with that information as well. So just pay attention if we need to extend that. And that goes for extending that. And if we have any type of weather event, or if something happens on campus where we don't want you to come to campus, you should get some alerts with that information, okay? So if a class says SP, that means it's synchronous. Yes, that means it's synchronous. Okay, admissions process. All of your programs listed here, we mentioned they have a separate admissions process, and we look at grades and coursework, whether you have any type of certifications or licensures, any credentials like previous degrees, and your county of residency. We are Orangeburg Calhoun Technical College, so we give a couple of points for residents of the counties that we serve. There, we conduct health information program sessions. They're called HIP sessions. All of these right now are offered online through Zoom. And we have one coming up on January the 18th. You have to go through a HIP session in order to apply to your programs. That's how you actually get the application. Now, if you're just starting out and say you're in Bio 117, this semester. You're taking 118 in the summer. Don't worry about the HIP session right now, because you have to do the HIP session in the same year that you want to apply. So if you're just starting out in your gen ed classes, let's wait until you get, say, 210 to 11 under your belt, and then you can start thinking about actually filling out the application. Each program has what's called an admissions overview. It's filled with very useful information. It's almost like your handbook for filling out an application for the program. I think I have screenshots of one, yes. So each program has an admissions overview. This is the ADN admissions overview for 2021. You'll notice the application submission dates. So February the 1st to May the 13th, that's your deadline. And this is for the class that's going to start fall 2021. And the students that apply in this window will know whether they got accepted by June the 11th. So you have some very useful information here in the top, very first part of your admissions overview. Second page goes over your requirements. Your high school diploma, you have to do a HIP session, transcripts from all colleges, your reading test score requirement, GPA requirement. We have what's called guaranteed tracked admission. So if you read over this, if you meet those qualifications when you apply, you will be guaranteed a spot in the program. Then we go over the technical standards, the costs, projected expenses. A lot of students skip over this part, and then they get to the point of getting accepted into the program, and all of these things are due, and it's almost like they're blindsided. So you need to really be thinking about saving money, putting yourself in a good financial standpoint, so when you start your program, this side is not a major stressor for you, okay? So it's good to start now. And then it comes to the rating sheet. Rating sheet, you can see your classes, your letter grades, and how many points each letter grade is worth. Put the grade here, points here, and at the end we add everything up. This is similar to that checklist that we looked at in the Virtual Student Center. The Virtual Student Center checklist comes straight from this document, okay? So you can literally take this and the checklist and go through as you start to collect all of these classes on your transcript. So now that we are at the point of, we've gone through our, how we find information on the website, Virtual Student Center, we've gone through all the classes, gone through all the certificate programs, the diploma programs, the degree programs, and all of your options for you as far as classes, how those classes are gonna look on your schedule, and how those classes are gonna look come next week. Now is a good time for us to, for all of you to meet some of these program coordinators from these areas. And I wanna start off with Fran Andrews from the Radiologic Technology program. Fran, are you with us?
I am.
Okay.
Can you hear me?
Yes, I can. I will.
My computer was popping up about unmute, so I was like, I'm unmuted. Good morning and welcome to OC Tech. Just to tell you a little bit about the radiology program, we are a 6-semester program. We have an associate degree at the end. We're very competitive. Ms. Brown was telling you about the classes and so forth that you need. It's highly recommended that you get your biologies and maths out of the way, especially the biologies, because those tend to be the classes that students struggle with while being in the program. The other piece of that is because of how the program is structured, you may end up having to take a night class if you don't get your gen eds out of the way, or you may have to take an online class for it to actually fit around your radiology program courses. So again, I encourage definitely the bio 210 and 211. And if you can get them all out of the way, then if your GPA is high enough, you can possibly get in that guaranteed track that Ms. Brown was talking about a few minutes ago on that admission, because we all have the guaranteed track avenue. And so a little bit about the program. As I told you, we're a 6-semester program, and our students, once they get into the program, they actually start clinic the very first semester. So we have a course component and teach that, and then you go into the clinical area like the last half of the first semester. We have clinicals that are in Orangeburg, Columbia, and Manning. So they're kind of scattered out, but that gives you a good opportunity when you look for a job that you've been in all these different facilities. And so each day you go to clinic, you're on a job interview. And we highly encourage you to be real energetic and interactive and helpful and so forth once you get in those clinical areas. Our courses are all day courses. During the clinicals, you do have evening and weekend rotations, but you know that up front when you get your schedule at the beginning of the semester, when you're going to do weekend and evening rotations. And so one semester you may do an evening rotation, and the next semester you might do a weekend rotation. But here again, this gives you an avenue to show what you know and to make yourself very marketable once you graduate from the program. We have a good 100% pass rate on our boards. We've got good job placement rates of 100%. And we're very proud of our program. We've got dedicated faculty. It's myself and 2 other full-time faculty. Once we get a student into our program, we want to make sure that they're going to be successful, and we want to keep them there. So we work hard with you, but you also have to do your part. Be on time, come to class, all those soft skills that I'm sure Ms. Brown has already talked to you about. And so that you can be that good student, you have to come to class to be prepared. You can't, we don't recommend you work more than 20 hours a week in our program, because you need plenty of time to study and so forth to get what you need and be successful. I'm going to stop and ask if you have any questions of me right now. I'm not sure how much more time I have, but are there any questions that you have of me concerning the program?
If you have any questions, just put them over in the chat and I'll read them out.
So while I'm waiting to see if anybody has any questions, as I said, our program is competitive. So there's an admissions sheet out there for radiology, just like the one that Ms. Brown showed you for nursing. It's for all of our programs. And again, we're here to help you succeed. And once you get through our radiology program, we've got some certificate programs that you can branch off into and further your education here on our campus. And if it's something we don't offer, then there are other schools that we have in our area that can also help you with that.
Ms. Andrews, I don't see any questions, and
Right.
I want to thank you so much for your time. Students, if y'all have any questions for Ms. Andrews, you can put it in the chat, or you can go to the Virtual Student Center and get her email address, and you can email her, and she'd be happy to help you in any way that she can.
Absolutely. Good luck, and hope you have great success here at OC Tech.
Thank you, Ms. Andrews.
All right. Bye-bye.
And next up, we have Lynn Fralix, Ms. Lynn Fralix from the Physical Therapist Assistant Program. And I will turn the floor over to her.
Okay, thank you, Stephanie. Good morning, everybody. And again, welcome to OC Tech. I'm going to tell you just a little bit about the Physical Therapist Assistant Program, and then I'll give you a few minutes to ask me questions also while I'm here. And if you don't get the questions answered during our little time together now, then certainly feel free to get my information off the website and send me an email or a phone call, and I'll certainly be glad to talk to you one-on-one. But the Physical Therapist Assistant Program is a 5-semester program at OC Tech, and we're a little bit different in the other programs in that The first 2 semesters are when you take all of your general education courses. So you knock out the biologies, the maths, the English, the computer courses, those kind of courses. You knock those out immediately. And then we use your GPA from those courses to offer acceptance for the students that have the highest grades, in the gen eds, for who gets into the last 3 semesters. And the last 3 semesters are when you take all of your physical therapist assistant courses. So once you get accepted into the program, it's 3 semesters. So right now in the spring, the class that we have accepted now, as of last year, is in their last semester. So they will graduate the end of spring, and then we will start our new class in May. So, we accept applications in January and February, and you're notified the first part of March as to who got accepted. And then it's a quick turnaround, I guess. You get accepted in March, and basically you start in the summer in May. So as far as the program goes, I mean, physical therapist assistants work with patients that have what we call impairments. So whether it's an injury from a sporting event or an injury such as a muscle weakness or limb loss or anything like that related to a stroke or any other neurological condition, that's what we work. So we work towards assisting patients with getting back their independence. So helping patients walk, helping patients get stronger, build strength, build, the ability to move their arms and legs better, those kind of things. And so as far as physical therapist assistant, the program goes, like I said, it's 5 semesters. The first 2 are your gen eds. The last 3 are the physical therapy courses. And so, like I said, it runs summer, fall, and spring once you get accepted into the program. So summer is, of course, the 10-week session. And then in the fall and the spring, we do coursework and lab work, and then we send students out anywhere in the state of South Carolina for their clinical rotations. So you have 2 7-week clinical rotations that occur at the end of the fall and the end of the spring semesters. And 1 clinical rotation has to be in an outpatient setting and 1 inpatient setting. So you have, the 2 settings, the inpatient and then the outpatient. We try to make sure that students get a comprehensive education. I know a lot of students want to do sports medicine and outpatient, and then they get in the program and realize that there's a lot of acute care and inpatient rehab and stuff associated with what we do, and they realize after their clinical that they really prefer to do that. And so, you can work with pediatrics, middle age, adolescents, adults. You can work with geriatrics. So, we treat patients across the lifespan, and we treat them in a multitude of different clinical settings. So physical therapist assistant has a very high need right now for employees. And so our students easily find jobs at 100% employment rate since the program started. And I'll say that most students find jobs before they even graduate. And I think Ms. Fran had pointed out earlier that sometimes when you're on your clinical rotations, it's sort of like a job interview. And that's what we've seen, because a lot of students on clinical rotations are offered jobs even before they graduate. So that's a little rundown about the PTA program. I will say, or I will encourage you, if you're interested in our program, to check out our website. We have a lot of good information about the day-to-day operations, what to expect, what's a day for a PTA student entail, and all of that is on the website. And also just pay attention to the different admission criteria sheets, because they are different program to program. Okay, we have different requirements than other programs, so just pay attention to the detail for the specific program that you're interested in. And also PTA wise, we also have a form that we would like any potential student to fill out, and it's called "Are You Ready?" And it basically is to give you your answer for, are you ready and prepared to be a PTA student, and do you want to be a PTA? So if you're kind of questioning, do I want to be a nurse? Do I want to be a PTA? take the Are You Ready form, because it really does talk you through the details of what a PTA would be doing for a job duty. And I think it's very informative and helpful for prospective students. So if you have any questions, you can ask me now. You can unmute yourself and ask, or put it in the chat, and Ms. Brown can help me get those questions answered. Or again, my name and number and contact information is on the website, and feel free to reach out. I'd love to talk to anybody interested in the program individually and get all your questions answered if you'd like.
Thank you, Ms. Fralix. I don't see any questions coming up for you at this time, but if I see any, I'll forward them to you, okay?
Okay, sounds good, and I wish y'all the best, okay? Good luck to y'all this semester.
Thank you so much. And again, just to echo what she said about PTA, the admissions process and the requirements are a little bit different. So if you find yourself at a point where you're confused about anything or you need to get some clarification, please reach out to me and do so sooner rather than later, because their admissions window actually is, I think it's January to February. So we want to make sure we have everything in place before that spring semester starts. And oftentimes that means taking classes in the fall. So just make sure you reach out so we can really get you on the right path. So now we will hand it over to Dr. Shaka McGee over the medical assisting program, and she will give us some pertinent information about that program.
Hello, good morning. Can you all hear me?
Yes, ma'am.
Okay. All right. So good morning and welcome. I'm going to speak with you about the medical assistant program. The medical assistant program has changed a little bit since I've been over the program, meaning that you are now able to get 2 certifications instead of 1. The difference is you will start out by getting a phlebotomy certification. So in order to be accepted into the medical assistant program, you have to have qualifying courses. And those qualifying courses would be your phlebotomy classes and microcomputer application classes that you must take before you start the medical assistant program. So, which is a good thing, because once you graduate, you'll have a phlebotomy certification as well as a medical assistant certification. The medical assistant program is 3 semesters. We start new classes. For a new class will come in August, and you graduate in July. For both of those certifications, you must take a certification exam. So for the phlebotomy certification, you will take a certification exam, and for the medical assistant program, you will also take a certification exam to be certified as a medical assistant. The medical assistant exam is administered in July before graduation. So you will take the certification exam before you graduate in July. It requires you to go out for clinicals as well. And I think Ms. Andrews spoke about it when she stated that when you go out for your clinicals, it is a chance and an opportunity for you to get a job. A lot of our students that have gone through the program have, once they have completed, they have went back and got a position and a job in the clinical atmosphere that they were in to do their clinicals. So that is an opportunity for you to be able to get employment. There has been a great need for medical assistants now due to the coronavirus, because you will be one of those people that will be administering tests when patients come into the office. You will be doing a whole plethora of things associated with taking care of patients into the medical office as a medical assistant. A little bit about the classes. A lot of our classes now, as due to the virus, are through virtual, but we do have face-to-face classes where we have labs. So you will be doing a lot of hands-on techniques as far as doing EKGs, patient exams, blood draws, administering different types of medications. So you'll be doing a lot of that as far as hands-on when we're dealing with the lab techniques of the medical assistant. As I stated to you, it is 3 semesters, so you do graduate in July. You must maintain a C average in each class. You cannot get anything below a C, so you must maintain a C average in order to continue on in the program and with all of your classes as well. Okay. I think that is, to sum it all up, all that it entails with the medical assistant program. Or if there are any questions, you can unmute yourself or you can write it in the chat box, and Ms. Brown will give me those questions.
I don't see any questions just yet, but one thing I want to make sure, any students that are interested in the medical assistant program for the fall, you need to come and see me about phlebotomy, because we need to either get it on your schedule for the spring if we have any seats opening up in the spring, or we can slide you into a class in the summer. So I really want to make sure that we have that done before the fall semester approaches. I don't see anything, Dr. McGee.
Okay.
But if I have anything, I will send it your way, and thank you so much for your time.
All right. Thank you.
All right, and we are headed to the nursing area. And I think, let's see, yep, I have Susan Chavis, Mrs. Susan Chavis from the nursing department. She's going to talk to us today about the associate degree nursing program and also practical nursing.
Hello, everybody. I'm sure I've got a lot of y'all in here looking towards the nursing program. I answer calls every day about what can I do to be competitive. Let me tell you, if you are just starting your nursing, your general education courses, I'm going to tell you to strive to get an A in every class. Because when you look at our competitive admission programs, it's all based on the grades that you made in the gen ed courses. And so if you're just getting started, we know sometimes whenever we were younger, we started out the first semester of college, we didn't take a lot of it seriously. So we were all happy to get that C in English or that C in math. But let me tell you, those C's in those maths and biologies are not going to make you competitive when you're coming into nursing. This fall, I'm gonna kind of talk about nursing altogether because we've revamped our entire program. I am now the program coordinator for all of the nursing. And so we are all teaching across the board. So we have LPN program and we have an associate degree program. We have 3 options for the ADN program. And so you can look and see a lot of different options in there. But the main thing that they all have in common is those gen ed courses, that English 101, that Biology 210, that Biology 211, Math 101, Math 102, Biology 225, and a Humanities elective. There's 7 major courses that are required if you're wanting to do the ADN program. Do not skip a semester with a biology. People will say, well, I'm going to take some courses, but I'm not going to do biology. Realize that biology needs a 117 and 118 before you can take the 210 and 211. We don't list that in our curriculum. Oops, sorry, hold on, let me mute this. And we don't, that's probably somebody calling asking about a program, but we don't list those in our curriculum because we require 210 and 211. So sometimes people don't realize there are 4 or 5 biologies that you have to take. So again, I say do not skip a semester with a biology. You need to take one every time. And I'm going to tell you now, my motto is a little every day goes a long, long way. Every one of my nursing students will tell you that Chavis is going to say you need to do a little studying every day. You don't cram the night before a test, because when you're doing some of your gen ed courses, you're going to take a math test and then you can forget that part of that math and you're going to move to the next section of math. Realize that if you start now in these gen ed courses preparing yourself on how to study, how to take notes, go to the Student Success Center and make sure you understand it. You will be more successful in those gen ed courses to get those A's, okay? Please go. We have biology tutors, I'm sure y'all have already heard about. Take advantage of all of that, because nursing in the fall, for example, we accept 75 LPN students in August into our traditional program, and I think I had 100 and something apply. Our ADN program, we accept 50 students in the fall, and I had 125 apply. So it is very competitive. Once you apply and you're not accepted into the fall, we are working on, we do accept the traditional in the spring also. And so you can turn right around and reapply to that one. We're looking at that now, the way we have the application. So the number one thing I want to say is whatever program y'all are interested in, go on and print that program admission overview off of the website right now. Put it in your top of your notebook and let that be your goals. Those are your goals of what you want to do. Go in there and make a note. When you see biology 210, make a note that you've got to have 117 and 118 done first, so that you kind of start working out a plan of how you want to get to the point to get to that application process. Again, we tweak it every year, so you want to look at that every year, okay? Don't print it now and 2 years later realize we added another course that you haven't taken. So always check that. With the LPN program, it's a 3-semester program. And I don't know if any of y'all have looked in the catalog yet. All of the courses are listed in your catalog, and you know how you can go in the catalog and you actually can see, and I'm just going to say, for example, when y'all look, if you happen to look in the catalog, and can y'all see this where it lists the courses that you take each semester? What I want y'all to realize is where we list, people say, oh, I can start the nursing program before I take biology 211. Yeah, you can if you have enough points, but you probably won't get in for people that have already completed those gen ed courses, because again, your points are based on your grade. And I also want you to realize that when you look at that, that what you're seeing is wherever I have biology 210 listed, that means that's the last possible semester you can take it. So you don't want to let that be your first time of taking it. And if you're unsuccessful in that semester, we have to drop you from the nursing program. We have some people who did get in this fall and they had to have biology 210. They were taking it this fall. And if they weren't successful, they're not coming into they had to drop out of the nursing program in spring. You only get 2 opportunities to do a nursing program. So my suggestion is get those biologies out the way. You don't want that to be something that would pull you out of the nursing program once you got accepted, because you have to have that course completed wherever it's listed in that semester guide. It looks like you can take biology 210 in the fall with nursing 134, your fundamentals course. But what that means is if you wait till then to take it, if you're accepted and you don't pass it, I have to drop you from the program. And people don't realize that ahead of time. The ADN program, traditional, is a 5-semester program. As I said, the LPN program and the LPN Flex program is also a 3-semester program, but it is designed for people who have already got their CNA license, their MOA, pharmacy tech, any kind of current certification. You could apply for the PN Flex program. It's the same 3 months, but we only meet 1 day a week for class and 1 day a week for clinical, whereas the traditional come another 3 days usually instead of just 2. So if you're thinking you might want to do nursing and you're not quite there yet, please apply, get your CNA license. Even if you do traditional, the CNA license is going to have you more competitive on your application because you get points for that. And you also will be able to have a little more clinical knowledge before you come into the labs. Nursing is, again, very competitive. We have strict guidelines. You don't pass our nursing courses with a C. You have to have a B, okay? So gen ed courses are a C, but that does not work for nursing. 79.5 is required for every nursing course. You cannot take a nursing course until you are accepted into a nursing program. And that's only through the competitive admissions. I think the main thing I want to say to y'all is to stay focused on your classes, utilize all the resources we have to help you be successful in each of those courses, and to get the highest grades you possibly can. Take it seriously. When you get into nursing school, people will say, well, I work full time. Okay, I'm going to tell you, we've got some people working full time. They're struggling, and we understand life, and we try to work the schedule. But that second semester for ADN, you're on campus Monday through Thursday, and then usually have clinicals on Fridays also. So it's not easy to work a full-time job. And like Ms. Brown said, please start saving up your money, because look at those expense sheets, because we have about $6,000 or $8,000 out of pocket that you have to pay. We try to get a lot of those things in the bookstore, so financial aid covers it, but uniforms, background checks, drug screenings, all of your blood work that you have to have, immunization records, that's all on your own. That'll be, once you're accepted, you will get you will get a list of things that are needed. But if you've had immunization records, I'm going to tell you now, especially if you're older, go on now and start trying to find those shot records, okay? Because it might take you 2 years to find that shot record. But I was a high school nurse. All of our programs require immunization records. So I was the school nurse for 16 years. Your high school has to keep your immunization record for 75 years after you graduate. So I know they have it. They probably charge you a couple of dollars to get it, but you do need to go ahead and start making preparations to avoid those delays. If you're planning on doing any of our courses, go on and sign up and get CPR done with Ms. Collins while you're here, because it's not covered under financial aid once you're accepted into the nursing program. So go on and get CPR done while you're in your gen ed courses. Let that be one of your electives. I'm not going to go into a lot of detail more about the program itself. Please email me. I answer emails. I answered them all holiday. If I'm in my office, I will answer you, but it's easier if you email me, because I have a standard little typed up form that might give you some more information. But if I can answer some general questions for you, please put them down in the chat, or I am free to entertain if Ms. Brown has a few more minutes. Where are we at? Oh, we're on 11 o'clock now, so we might be out of time. But if you have questions, email me, call me if I answer my phone when I'm in this office. But I will gladly answer a few questions if you got something in the chat, if Ms. Brown wants to entertain a few.
I've been trying to keep up in the chat,
Okay.
and I think most of the questions, we probably need to look at everything together. You know, if you're asking a question about applying to a specific program, that's a loaded question, because we have to look at your GPA on all of the classes. We have to look at your test scores. We have to look at your points, how your points add up on that rating sheet. We just need to make sure we cover all of our bases. The other thing is an appeal. Students tend to overlook the appeal requirement that's on the admissions overview. But if you've been unsuccessful in 2 or more health science or nursing or healthcare related programs or classes, you need to file an appeal, so that, you know, it's all the information is there, but I would like to look at it one-on-one, so we can just make sure we have all of the boxes checked, so we can see if you're in a good place. I do have a question.
Yeah, I was going to say before you go further, Stephanie, I was going to say the admissions overview, even still when I read it, it's still a little bit confusing. And let me say this, because I did see Felicia pop a question up. If you are unsuccessful in 2 nursing courses for ADN, you cannot apply back to ADN program for 5 years. but you can apply to the LPN program. Okay. And then if you were unsuccessful in 2 courses in the LPN program, then you cannot apply to the LPN program for 5 years. Okay. But we do have an option. So basically you could get 4 shots at nursing. Okay. And we don't want to have that. That's why I'm telling y'all, if y'all can work ahead of time with the Student Success Center and you learn your study skills with biology, before you get to nursing, you are going to be so much happier with yourselves. Okay. Don't think, oh, I got this, I don't need any help. Everybody needs a little help. Okay. You cannot do this by yourself. We are all here to support you and to give you some advice and to help you stay on track. But LPNs, RN, if they are unsuccessful in a course, we have pathways through Dean Tooley that we can do some things to help some people, but not everybody. I mean, if you're unsuccessful with a 78 average, I mean, we have people unsuccessful with 79.4. We have a cutoff, that's it. 79.4, you don't pass the course. 79.5 passes. We can't say, oh, we'll just give you that 0.1, because I'm not going to give you a 0.1 and let you get to the next course, because you're going to struggle even harder. Okay. So we've got tutors and everything once you get into the nursing program, but we're here. And so those, we do have ways to work around, but again, it's up to you to do the best you possibly can do. And then we look at everybody on an individual basis whenever we are looking about progressing further in the nursing programs. All right. Sorry, Stephanie.
Oh no, great. Thank you. That was great. I was typing answers over on the side. Something came up in my head and it left just as soon as it got there. It just flew out. I have a question about the TEAS test. How many times do you have to take the TEAS test? So the TEAS test is not actually required anymore. I'm going to back up to here. You have 5 different options for meeting that reading score. Your SAT, ACT, TEAS, make sure it's version 5, or ATITs. Accuplacer reading, if it's the regular Accuplacer, it has to be within 5 years. Accuplacer Next Gen. Now, I suggest students, if you don't already meet these reading requirements, I suggest that you take the Accuplacer Next Gen reading. The first time you take it is free. You just have to go through admissions and they'll set up where you can request and get your test scheduled. And you'll notice here that score is 250 is what you need to make on that Accuplacer, but you have options. You don't have to take the TEAS. That's something that changed within the last, I'd say 2 years maybe. Okay, there was a requirement that you meet a certain level to be able to be accepted into the Flex ADN. Yeah, let's talk about that 101, and that's on the admissions overview too. If you look on the admissions overview, I think it's on page 2 or 3 of the PN to ADN admissions overview, you'll see it listed there, okay? So we will, just for the sake of time, I'm gonna move on from this. That covers all of our programs. And again, all of the information is available to you online. So you can go to our website, www.octech.edu. Just like I said, click on academics, nursing and health science. That virtual student center, again, you can't break anything in there. So you can explore that content, look through all the checklists, pay attention to any announcements that come out. I try to put information out for you all when application windows open up, when the deadlines are approaching, when it's time to register for classes, or if anything comes up that I think you need to know about. So pay attention to that, virtual student center. Participate in our campus events. We have a lunch and learn series that we do. We used to do it on campus and we would give you lunch, but of course that is not in the cards right now. Our first Lunch and Learn is coming up on January the 26th, and it's going to feature the PTA program. So if you're interested in PTA or learning more about PTA, that Lunch and Learn will be January the 26th at 12 o'clock. We do have health career symposiums where we have professionals from the industry, as well as our faculty members that come in and answer questions and give a lot of useful information. We have webinars that are available. All of this stuff that you see under campus events, all of that's free for you and anybody can attend. So even if you have someone at your church that might be interested in a healthcare career, or a sibling or your parent even that might want to learn some more about a specific career or program that we have, anybody can come to those events. I have one question here. Should you already have taken all bios even if you apply for the LPN Flex program? Ms. Chavis, can you answer that question? Okay. Oh, I got it. Oh, sorry. I have to give her permission. This is some power that I'm not used to.
They definitely want to give me permission to speak, but control it. That's a definite, because I can go all day on nursing programs. But yes, you have to have biology 210 and 211 to take in the nursing program. And the flex program, you have to, PN flex, you have to have all of your prereqs done before you can apply. So you can't apply for PN flex unless you've taken the 5 gen ed courses, okay? And if what we have is our LPN students can apply in June before they graduate, between June and August, they can apply for ADN flex and transition or ADN traditional for the fall or spring start. So you're able to turn it in. The thing is if you don't have micro already done, you can't take micro during the PN program. We strongly encourage you not to try to take courses for the ADN program while you're in the LPN program. I got people doing it right now, and they struggled in the fall. And I've got some that are going to be doing, we have 3 nursing courses in the spring for LPN, and they're going to try to take micro at the same time. You know, it's not required. So if they're not successful in it, it's not going to take them out of the program because it's not required for PN. But they're not going to have those points, and then they've just struggled throughout the whole PN program. When I tell people, if you're coming into PN, stay focused on getting your PN and get your LPN license, and then worry about ADN. But while you're in the fall, before you ever apply, I suggest you go ahead and get the micro out of the way if you have any intentions of going for an ADN later. Same way with the AHS 210 nutrition course. I would suggest you could do that one also, because those points are on the LPN application. So you will get those points on the LPN application, even though they're not required for the LPN program. So you're just making yourself more competitive the more of those courses you get done.
Thank you.
All right.
So I'm gonna sort of try to cover everything fairly quickly. We have faculty advisors here that you should already be assigned to. Advisors are very important because they are there to guide you through the program and also help you lay out all of your classes. And they really should be the point of contact if you start to struggle in any of your classes, or if if you have transportation issues, internet issues, come to your advisors. You can also go to your instructors too, because we're all here to help you at the end of the day. Your advisor, you can find that person in Connect. You can also find that person in the Virtual Student Center. You always want to make appointments instead of just walking in. Email is going to be your best friend when it comes to your advisors, because especially if you have an advisor that's on the health science or nursing side, a lot of times we're not in our offices. So email us and request communication or an appointment. Our office hours are posted online as well. So just reach out to us as much as you can. Now, when it comes to registration, we advise you on what classes to take and we approve those classes, but you have to register yourself. So you would be the one setting up what actual classes you want to take, as far as if it's online, if it's in person, if it's on Monday, Wednesday, if it's on Tuesday, Thursday. You have to set that part up. We just approve the classes for you to take. Now, once you get registered, a bill is going to generate in the system. Just because you registered does not mean your bill is paid. So you need to then go in and make sure, if you have any financial aid, that it's applied to your account. If it isn't, then you need to contact financial aid. If you pay out of pocket, you need to make sure your bill is paid by the deadline so you won't incur any late charges or anything on your account. So just to clarify, advisors approve your classes, so you need to contact us when you're ready to set up your classes for the next semester. We'll get your classes approved. You go into self-service and register yourself. Once you register, then you handle the billing side, okay? And whether that's paying out of pocket or whether that's financial aid. And then once all that's taken care of, then you show up on the first day of classes. Your GPA is cumulative of all classes. So if you fail a class, it's going to negatively impact your GPA. Now, if you attempt that class and you pass it, it's going to recalculate your GPA. So just make sure. I always tell students, even if you don't need a class for a particular program, repeat that class just so it cleans up your GPA, okay? And it also looks better when you start to apply for jobs. If you have a class that you had an F in, but you retook that class and you got an A, it's not just like you're leaving a trail of Fs on your transcript. Withdrawals, just make sure if you need to withdraw from a class, that withdrawing from that class could impact your bill and how all of your financial aid is calculated. So just make sure if you want to withdraw from a class, I always request that students go to financial aid first, because if you withdraw too early from a class, it could reverse your financial aid, but your bill is still due. So you could end up with a bill that's thousands of dollars just because you dropped the class too early. So just make sure you run everything by financial aid. And let's see what else we need to do. What makes a successful student? Read your syllabus, know where it's located, know your expectations. This is your journey. You have to do the work. Your instructors are here to help you and to help facilitate that, but we will not do the work for you. And you need to take some ownership in your own journey, okay? Read the attendance policy. Understand face-to-face versus online. Online classes do have attendance. You have to be present in an online class. So that means checking every week, checking when things are due, getting your assignments in on time. In the classroom, when we get back to campus, you need to treat everybody respectfully. Pretty much treat everyone how you want to be treated. We're all adults, so we need to act accordingly. Same thing goes if you're in an online class and you're in a discussion forum. You know, make sure everything that you write is respectful of other people and yourself. Textbooks are required for classes. You might have classes that don't have textbooks, but your syllabus will tell you that. You probably will not pass a class if you don't have the textbook. So you need to make sure you can at least get the textbook. Safety is our main concern. We are heavily relying on electronic devices right now. Make sure you dress professionally. You heard your program coordinators say more than once, you are always on a job interview. So make sure you're professional in your appearance and your behaviors. Now, your instructors, we are here to help you, and we are very friendly, but this is a professional environment. So make sure when you're communicating with your instructors that you handle yourself in a professional manner. That can be how you set up an email. We have an email system, we don't text. So you need to, put a header. Hello, Dr. Brown. My name is so-and-so, and I'm emailing you about such and such. Can you help me with this? Thank you, your name, and possibly a contact number. So if we need to, if it's easier for us to pick up the phone and call you, we can do that. But don't send us an email that says, when is that paper due? That's a completely unprofessional way to communicate with your professors. You need to set up an email properly. If you don't know how to do that, go into the Virtual Student Center, and of course, I have an example for you. Or you can email me and I can walk you through how you need to communicate with your instructors, or if you need to contact anybody else on campus, I can help you with that. All of our college policies are listed in your student handbook and your planner, and also on our main website. Time management. So this is something that a lot of students struggle with. You need to pay attention to the number of hours that are required for a class or a lab. If it is an in-person class, that is how long you will need to be in lab. So for instance, if a biology lab is 2 to 4:50, 2 p.m. to 4:50 p.m., you will be in lab from 2 to 4:50. You don't need to show up at 2 o'clock and then ask the instructor if you can leave at 3. You are scheduled to be in lab until 4:50, okay? Know that the rule of thumb is that you need to dedicate 2 times the number of hours per week that a class meets. So if your class meets, say 2.5 hours, then times that by 2, that's how much time you need to study, okay? I know we all have other obligations and it can get to be a bit much. So you just need to, as you start to navigate this, it might be beneficial to bring some of that class load down in order to be successful. And that's where your advisor comes in. So you can meet with your advisor and say, I'm getting a little bit overwhelmed. I have, say, 15 hours that I'm registered for. And your advisor can say, okay, well, maybe let's drop these 2 classes so you can focus on these 3. Those types of decisions you don't have to make alone. You can make that with your advisor, with financial aid, with student services. So just make sure you reach out because we're all here to help you. Participate in your classes. That is very important in an online class. Also important when you're in your labs. Make sure you come to class, you're not tardy, interact with your instructors. It's always better if you build that relationship with your instructor, and then that way they will notice when something starts going wrong with you, and then you have that person that you can go to if something starts to happen, okay? Use our free resources. The library, free. Student Success Center, free. Tutoring, free. Trio is free. We even have career development and job placement, counseling services, security. All of these are available to you. We have online tutoring through BrainFuse. You can access that through D2L, through any of your classes. So all of these free resources are here for you to take advantage of. So just reach out. If you have any questions, I can help you navigate all of these. Student organizations. We have the Student Advisory Board, Phi Theta Kappa Honor Society. We also have a Veterans Association. And when you get into your programs, you will have the opportunity to join any of their student organizations. I feel like I am talking. Are there any questions? Let's go to the chat. Where can I purchase my textbooks? Is it in the bookstore? Yes, you can get your textbooks from the bookstore. Other questions? What do we have? That was a lot. That was a marathon just now. I don't see any other questions coming up. My email address, I'm going to put it in the chat again for you. .edu. Biggest thing, where do you download Office 360? It's either in D2L or it's on the library site. I think it's on the library site. I'll tell you what. Check the library site. If you don't see it, then go to our main website And in the search box, just put Office 365, and it should, the link should pop up there. I'm thinking it's on the library site. Biggest thing for you between now and the start of classes, check D2L, check all of your classes. As your syllabi and your class calendars start to become available, go ahead and print those out, write them out, all of your due dates and your planners. Make sure your financial aid is straight. Go in and check your bills. What else? All of my competitive admissions students, go ahead and get that admissions overview. Print that out for your programs. Should I contact my advisor if I cannot fully understand my class schedule? Brandy, shoot me an email. We can do that now. We can go through everything now. And yeah. Because it's probably, what you're probably not understanding is how multiple things show up, like in one class. You might have a virtual, you might have, you know, a class meeting time. So yeah, just shoot me an email, we can go through it. And yeah, anything that you have, just shoot me an email. Make sure you understand we're virtual next week. We're virtual for the next 2 weeks. January 25th, we're back on campus for your face-to-face classes. Hang on. GadsonSC@octech.edu is my email address. So if you all don't have any questions, you are free to go. We are so happy to have you with us this semester. It's going to be a great semester. You know, we're just going to keep going. If you have any questions, you can stay on and keep putting them in the group chat, and I'll try to answer them for you, or you can send me an email. But other than that, y'all have a good spring, and we're happy to have you here, and I cannot wait to see you at graduation, because that's where I'm going to see you.